Doctors and What They Do by Lisbeth Slagers, published by Clavis. It's not nice being sick. To get better again, you can visit a doctor. A doctor knows a lot about the body. The doctor figures out what's wrong and checks if you need medicine. But you can also visit the doctor when you're feeling good. Then the doctor examines your entire body and tells you how you can stay healthy and fit. The doctor wears a long white coat over her regular clothes. The doctor's coat has pockets, so she can carry a pen, paper, a stethoscope, and many other things with her. A doctor who performs surgeries wears special clothes: a surgical gown, a surgical cap, plastic gloves, a surgical mask, and shoe covers. That way, bacteria don't stand a chance. Bacteria are teeny-weeny animals that can make you sick. The doctor examines her patients on the examination table. She uses a stethoscope for listening to the heart and the lungs, a blood pressure monitor, a light to look into the ears, and a tongue depressor to look into the throat. Once the doctor knows what's wrong, she will also need things to make the patient better again: a pair of tweezers for removing a splinter, disinfectant, sterile cotton wads, a pair of scissors, bandages, a syringe. Or she prescribes medicines and explains how you should use them. She checks if you've grown with a stadiometer. The scale shows how much you weigh. She keeps track of everything she knows about a patient on her computer. It's crowded in the doctor's waiting room. A little boy and his daddy are next. "Hello, Brad. I haven't seen you in a long time. My, you've grown. What's the matter?" the doctor asks kindly. "I'm sick," Brad says shyly. "Brad has a fever and has to cough a lot," Daddy says. "His ears hurt too." "I will take a look," the doctor says, "so I can make you better again quickly." Daddy helps Brad take off his clothes. That way the doctor can listen to his chest with her stethoscope. "I can hear your heart beating really well. That's a beautiful sound," the doctor says with a smile. "Take a deep breath, Brad, so I can listen to your lungs." Brad coughs. Then the doctor uses a special light to look into Brad's ears. "Now I'm going to feel your belly," the doctor says. "This might tickle a bit." She examines his stomach with her hands. "Is everything all right in there?" "You have a healthy belly, Brad," she says, "but the fever is making you feel warm. Look, this is a tongue depressor. Open your mouth for me so I can take a look at your throat." "Very good, Brad. There, now we will make you all better." "I'll prescribe some medicine," the doctor says. "You'll take 3 spoonfuls every day. That way you'll feel better soon. You shouldn't go to school for a couple of days because you need to rest." Daddy and Brad go home again. "Bye, doctor," Brad says happily. "Thank you," Daddy says. It's someone else's turn. A mommy enters with her baby. The child isn't sick, but needs a shot. It protects the baby against nasty diseases. "Hello, little girl," the doctor says. "Just a quick shot. It will be over in a jiffy. My, you're brave." The mommy comforts her baby. "It's no big deal. Soon the little girl will come back for another shot." A little book shows which shots she still needs. The doctor records the shot she just gave her. The doctor gets an urgent call. A child has been brought to the hospital. The doctor goes immediately to the emergency room. That's where patients go when they need help really quickly. After an accident, for example. It's very busy in the emergency room. A lot of people are walking around. In the distance, you can hear an ambulance. Someone passes by in a wheelchair. And there's a woman with a big belly. Maybe her baby will be born soon. Hello, my dear. What's your name? The doctor asks. And can you tell me what happened? The girl is crying. My name is Lola and I fell off my bike, she says. My arm hurts a lot. The doctor examines the arm and checks to see if the girl is hurt somewhere else, too. The nurse will take a special picture of that arm, the doctor says, so that I can see the bones inside it. Don't be scared, Lola. Taking a picture doesn't hurt. The nurse is already here. Mommy can come along too. Keep your arm very still on the table. That's good, Lola. The picture is ready. The doctor shows it to her on the computer. Look, there is a small crack in your bone. The doctor points. The nurse will put your arm in a cast. It will soon be healed. Lola gets to pick the color of her cast. You are such a brave girl, the doctor says, and you really have a nice cast. In a few weeks' time, the cast can come off again. Lola and her mommy go back home. Lola smiles, and when children go home happy, the doctor is happy too. A doctor can work as a family doctor, but he or she can also do other things. Some doctors perform a lot of surgeries. They get help from nurses. There are doctors that know everything about babies inside bellies. They give the mommies advice. Look, this baby is already really big. The eye doctor knows everything about eyes. He knows what to do when something is wrong. And there are other doctors too, like a dentist, a pediatrician, a dermatologist. Some doctors are prepared to go and help in other countries if necessary. That's really nice of them.